Good evening, good evening. Welcome. Thank you all so much for coming for this talk on our new book, Information Sick. My name is Lymari Morales. I'm one of the 3 co-authors on the book, and it was an honor and pleasure and just a wonderful experience to work with Joanne, Kenen, and Josh Sharfstein, who are here and who are going to lead us in a conversation tonight to bring some of the issues in this book to life. I just want to thank you all for making the trip to DC. I see some familiar faces, some new faces. Some of you may be your first time in our new building, our new home here at the Hopkins Bloomberg Center in Washington, DC. So thank you so much for taking time out this evening to join us and be a part of this conversation. We do have some books for sale available, and we will be signing some books after the talk. You can Venmo or Zelle, the information is there. And then if you want to share the book with others, it's available. The quickest way to get it is on Johns Hopkins Press website currently. It is on back order on Amazon, and Joanne's working to get those orders sped up. And so I think that's it. I'm going to let Josh and Joanne lead this conversation. Thank you to our guests who are joining us today to, again, bring this conversation to life.
All the four panelists who I'm about to introduce you to are all friends of mine and people I've known for quite a long time. Eric is joining us from West Virginia, which is a little bit of a long drive for a 1-hour panel. I've met Eric, is it like almost 20 years? Yeah, we were Kaiser Family Foundation Fellows in 2006, 2007, so it's getting close to 20 years. And when I met Eric, he was spending 6 months investigating oral health and dentures in West Virginia, and I thought nobody could turn that into a 6-part series. I read every word, and not only did I read every word, I remember it 20 years. He's a fantastic reporter, but the reason that he's here is that's one reason he's here. Eric also, he will tell you about some of his work, but he really broke the story of how the drug company distributors were dumping millions of pills into West Virginia, where he has made his home for many years, and he won the Pulitzer. And he will tell you, and when we get to it, sort of embodiment of what's happened to local news, and he's living it. We'll let him tell the rest of his story. Jane Norman, who I've also worked with. Jane has been a health reporter and an ag reporter and an education reporter and a budget reporter and all sorts of things. We worked together at Politico, and we knew each other before that. She's currently the Washington bureau chief of States Newsroom, and she'll talk to more. So she's also been a national reporter and can talk to some of the problems that are afflicting national news, but she's also part of the solution in that she'll tell you what she does. Shefali Luthra is one of my co-podcasters on What the Health for how many years? Were you at the very beginning?
I joined 5 years ago.
Okay, so for the last 5 years, she's a veteran. So we haven't seen each other outside of a little square box in a very long time. And she covers reproductive health for the 19th. And before that, she was at KFF Health News. Her career has also been on innovative nonprofits. And we wanted to throw one real doctor in here.
Josh is a doctor.
Josh is also a doctor. I met Helen 7 or 8 years ago. We've been part of a group of people that's convening every summer with the really looking at issues of trust and distrust and misinformation, and also the overlap or intersection with equity. And she's with the Council of Medical Council of Medical Specialty Societies, but she's also done a lot of work with the National Academy of what's the current name, Science, Engineering, and Medicine, on disinformation and how do we identify and elevate credible communicators. How do we sort of make the people who can be trusted be the visible ones? And it's turning out to be more complicated than we might have expected before the election. We're going to sort of talk about local news. The book is, we're going to talk about what's in the book. Local news, national news, misinformation, why it's so hard to fight misinformation, and then we're going to open it up. We're not going to talk the whole time. All of you here are, many of you are journalists, many of you are health journalists, some of you are health practitioners, some of you are Hopkins people. We are all living with this, and we'd like to hear your experiences and your thoughts, and nobody has the answers yet, but we'll talk about what's bubbling up. So Josh, you want to?
Well, thank you all for coming. I'm Josh Sharfstein. I'm the third author here, and I'm I come from the world of public health practice, having been a health commissioner for the city of Baltimore and health secretary for the state of Maryland, and I worked at FDA. This book kind of brings together that world with journalism and communications to talk about a condition that we are very worried about. We call it information sick. It's really about the disaster of our information environment and what it means for health. Let me just call out two people who are here who are really important to the book also. John Pullis is our research assistant. Did a phenomenal job helping us. If John weren't here, then every reference would be in all caps in a different format in line with the text, which is how Joanne writes references. But John turned it into actual footnotes, among other things that he did. Thank you so much for coming, John. And also we have our editor, Robin Coleman, from Johns Hopkins Press. Thanks so much for coming. Robin was very supportive of the project right from the beginning and had a very steady hand in guiding us through all kinds of interesting discussions. So thank you, Robin, for being here. And I also just want to especially thank Dr. Burston for coming. Dr. Burston was my teacher in medical school.
Yes.
In a course called Patient Doctor, which was basically about how to be a trusted clinician. I wrote about learning how to take a sexual history from Dr. Burston in the Boston Globe at one point during medical school. You really do need to earn trust to be able to get people to talk about intimate things as a physician, and so she's an expert in that too.
And his first patient was a 75-year-old grandmother he had to ask it of, which was a little tougher for you.
Yes, that's right. I think I really confirmed that neither of her kids were adopted and called it a day. That was pretty much about as close as I got to taking a sexual history. But this is a very important topic, and we are doing this where we're sort of bringing our points to life with these great speakers. So we're going to talk about the three kind of pillars of the problem, and then we're going to turn to solutions. The first is the decline in local news and what it means for health. And I'll just say, when I was a health commissioner of Baltimore City, the Baltimore Sun had at least 5 health reporters. Yeah, I mean, I'm sure they had it that I dealt with on a regular basis. There were at least 5. They were writing fantastic stories about health in the city. They were making projects that we worked on possible. It was, not that every article said the health department was doing everything right, but it was a very constructive journalism. It made a huge difference to a whole bunch of projects we put into place on overdose, on infant mortality. It was just a huge advantage, and so many communities don't have that. And so I have a very intuitive sense of what it means when you don't have that structure of people getting information in a clear way when that's gone. But I'll turn to Joanne to start with the first question to Eric.
So I'm going to let Eric sort of continue. I set the stage for Eric, he's not going to talk about teeth. He's going to talk about, he worked for a paper that he will talk about, a paper that really represented what local news should be about, gave you a lot of leeway to do projects, and talk about sort of what happened after this. The family had owned the family had owned the paper for decades, and then you brought this glory to it, and tell everybody what happened next.
I don't know if I'm the one that brought the glory to it, but it was founded
Part of the glory.
On this principle called sustained outrage, that you would hammer away at stories. I came in there at 1998 and worked there till 2000. One story that you reminded me of, because you put it in the book, Joanne, was that everything wasn't always roses and unicorns in terms of health coverage. I actually was a health reporter about 15 years ago, and they had trouble keeping business reporters. We had one health reporter ever since I'd been there. They had trouble keeping business reporters, and they kept recycling through business reporters. So one day they came to me and said, "Hey, we need you to do business. You're no longer going to be the health reporter." And I said, "Well, I don't want to do business." And they said, "Well, you don't have a choice, because we're doing away with the health beat." They brought it back later, and the business actually helped me with the stories about the pill dumping and the opioid crisis in West Virginia. So long story short, as Joanne was saying, Um, in well, over the course of the year, I did a couple of daily stories about this ongoing lawsuit that had we never had real numbers, but we went to court and found some we got our hands on some documents and through FOIA and stuff, that they were dumping millions of pills, even in small towns of like 400 people. There's one town that had 9 million hydrocodone and oxycodone over 2 or 3 years, dumped into a town of like 400 people. So it was just absolutely crazy. So
He has our book up there, but he should have his own, which is called Death in Mudville. It's a fantastic title for a fantastic book. So that's he wrote about this. You can still read about it. Yeah, go on.
So it kind of we finally got these this data from the DEA. It's called ARCOS data that showed every single pill over the course of like 5 years that had been distributed to every town in the state, every city in the state. I wrote a story in December 2016, and I kind of fell on deaf ears, and then Bernie Sanders picked it up and tweeted it, and it went viral, and everybody was talking about it. I was on CNN and all the other channels, even Fox News. I was on Fox News. Never thought that would happen. But then we were fortunate enough it won the Pulitzer Prize in April 2017. And 8 months later, the Gazette Mail filed for bankruptcy and was sold off, and the family no longer had a role in the paper.
What's you've done a variety of things since then, but when you pick up the paper, when you try to get local news, what's lost now in your community?
Yeah, Joanne, we had upwards of 21, 22 reporters. Now they have 4. They mostly do features. There's one guy that's really doing really good work, investigative work. We had when I was there, the year that we won the Pulitzer, they had 3, sometimes 5 people covering the state house, the state capitol, state government. Now they have 0, but thank goodness there's state's newsroom to fill in the gaps. They have 3 reporters, and initially there was some friction between the paper and some of the state's newsroom reporters were former Gazette Mail reporters, so there was friction, but that's all been worked out. The people that were involved are all gone, and now they have this great collaboration where I see it's almost like we're back to the state house coverage is actually excellent. They've got the 3 reporters, and all their stories are appearing. I still get the hard copy of the paper. I think I'm the only one on the block that gets it.
Do they have a health report? Do they have a full-time health report?
No, there's no full-time health reporter at State's Newsroom, but they do cover. They've done a really good job on what's happened to the opioid settlement money. They do an incredible job on foster care, and all their stories. Not all of them, but pretty much 80% of them appear in the Gazette Mail. So it's almost like we're back to where we were. So that's the good news.
Last time I looked
it was a shame because for like the first year or 2, they would write stories and they wouldn't appear anywhere in the paper. And being a new organization, they had a really tough time finding an audience. But now they found an audience, and they're just doing a great job. We're really fortunate for State's Newsroom.
That's the perfect introduction to Jane, who is the Washington Bureau Chief of State News. Why don't you? I mean, one of the things, as Eric alluded to, is local papers, in addition to losing health reporters and what Josh talked about at the Baltimore Sun that used to have. He dealt with 5, but there were 10. There's 1 now. They stopped. Local papers have pretty much stopped covering their state capitals. Pretty much, very, very little coverage. So I'll let Jane explain. And she could also talk about a little bit about state news, and also talk. You've been a national reporter. Eric's made his mark locally. You've been a well-known national reporter on a bunch of beats. Talk about how that it looks really different national news than it did even 5-10 years ago. So a little bit on states news, and then your perspective on sort of the second part of our book is about the polarization, the politicization of. It's really hard to find policy news and national, except for one or two outlets.
Yeah, Eric, thank you. I will take that back to the folks at West Virginia Watch and to everybody else at States Newsroom. It's the kind of thing that we really just live for, to hear a testimony like that. It's incredible. Thank you so much for saying that. I really appreciate it. States Newsroom, I've been there 5 years. We've been in existence for about 6 years. We're a nonprofit. No paywalls. We are funded by people who want to give us money to report free, fair, and independent news. I, as the Washington bureau chief, and each of the state editors, we write what we do and cover what we do according to our judgment as journalists. Nobody tells us what to do or how to do it. There are 39 state outlets in States Newsroom. Each of them have, like West Virginia Watch, an editor and 3, sometimes 4, sometimes 5 reporters if we can get a grant, or Report for America has also been very helpful. But generally it's about 3 reporters, and they work very hard. They're all people from the state. They know the state. They are not from someplace else. They are very experienced people, often from, like in the experience of West Virginia Watch, from what was once the dominant newspaper in that state that has now been, ripped apart. It really does not exist anymore. And I say that, I was a reporter for the Des Moines Register here in Washington for 20 years until they decided they didn't need to have a reporter in Washington any longer. And then I went to CQ Roll Call and became a health editor and reporter, which was great, but for me, but not so much for Iowa. And so these days we have an outlet in Iowa, and I'm just going to use the example and talk about health reporting there, called the Iowa Capital Dispatch. And at that outlet, the chief investigative reporter is a guy named Clark Kaufman, who writes constantly, absolutely, relentlessly about nursing home abuse in the state. His stories are harrowing. They are terrible. It is upsetting to edit them. It is upsetting to read them. And no one else is writing this stuff. The Des Moines Register, it was once a great paper. I worked there for many years. The staff is very small, and they do not do the kinds of work that they used to do. So, I mean, there's 5 people in Iowa. They can't do it all, but they let Clark roam free to do what he does best. And because of Clark, people in Iowa know a lot more about what is going on. And Iowa has one of the highest shares of elderly people in the country, too. I think competing with West Virginia, I believe, for shares of elderly people. So many of them are in these nursing homes or other facilities. So back to States Newsroom. We have a Washington bureau with 5 people, and we kind of divide it up. We cover some national stories. We cover some stories that are really oriented just for states. We cover some stories that are just about states. I have half a health reporter. My half of a health reporter also covers Congress. Just got the Dirksen Award yesterday,
Which is a really big deal.
for covering Congress, which we're extremely proud of because we are small and we are not the New York Times or the Washington Post, and so that was quite an accomplishment. She does a great job. One of the stories that was cited in her award was a story we wrote in March, seeing what was going to happen with Medicaid and rural hospitals. In the One Big Beautiful Bill, we could all see it coming, and she wrote a great story about that. As a former national reporter, to see the polarization of news, thank goodness for Kaiser. I mean, I recommend. I don't feel so bad about not doing so much health enterprise because Kaiser exists. KFF, yeah, and they do, KFF, and they do such a great job. And in fact, they have a reporter based in Iowa, Tony Lays, who writes a lot of.
Formerly was at the.
Formerly was at the health reporter at the Des Moines Register. I don't even know if they have a health reporter anymore, frankly.
I
don't
think
know.
one of the things that one of the points we make in the book is that local papers have basically killed the health beat, or they have somebody covering health and 8 other things.
Exactly.
And it's not that they're lazy, and it's not that they're stupid. They're just incredibly overworked, but that creates room for bad reporting too. So if you're a young reporter and you're covering health and education and labor and immigration and night cops every other Saturday and God knows what else, you don't have the confidence or the knowledge to sort of, the authority to sort of say this is the expert and this is the charlatan. There's a lot of both sidesism where this is the expert, this is the opposite expert, and it confuses. It's some of the misinformation is actually coming because local news has gone away. We have sort of innovators here and sort of exemplars, but it's not what most Americans are getting. Shefali, did you work anywhere before KFF? And she also has a book on women's health, which is reproductive
I got
health
it now,
called
yes.
Undue Burden, right?
I came to KFF right out of college, but in college I interned at the Texas Tribune, which
So you've worked in nonprofits the whole time. Okay.
only nonprofits. I think they are really the future and one of the real bright spots. Can I actually take that?
Yes.
Yeah, thank you. Which I'm so glad that you focus on them in the book.
Right. We have a lot of there's a lot of criticism and concern about the collapse of traditional news because they're bright spots, but overall there are a lot of not bright spots. We sort of decided to have an optimistic, hopeful panel tonight. But if you do read the book, I mean, there's like huge holes in what people can learn about. So these are people who are filling the holes. So Shefali would talk a little bit about what you're doing now at the 19th.
Yeah,
I think
so-
everybody here is familiar with KFF.
The 19th launched 5 years ago, actually. Early 2020, the CEO used to be at the Texas Tribune. She was editor-in-chief there, and I knew her from back being an intern. And she just had this vision that there was no national newsroom that really focused on politics and policy as a story of gender. And it seemed to her very obvious that there should be a newsroom that does that. And there should be reporters all around the country. It was very important to her that we had people in DC, if that's where they live, but also in Florida, and also in Iowa, and also in California, and in Illinois, and basically everywhere, so we could report from our communities and tell stories that maybe aren't being caught in the national press, but that are really reflective of people who have been neglected by news media, and as a result maybe don't trust it as much. And so I came in covering gender and health as a pretty broad mandate. This was the peak of COVID. There was a lot of stories I did about COVID vaccines not being tested for pregnancy, what it meant to be pregnant and worried about getting COVID, or ultimately to try and decide if you should get vaccinated. A lot of stories about the racial inequalities around who could get a COVID vaccine, thinking about mental health, and then my beat changed in 2022 when Texas had taken its abortion ban and let that take effect. And so I pretty much fully became a reproductive health reporter, but trying to think through the story of abortion bans and restrictions even before the fall of Roe v. Wade, trying to tell that through a story not only of women's rights, but also of LGBTQ plus people, of also thinking about the intersection of race and gender, and also trying to tell that story really outside of DC and taking us to places where we knew we could forecast how people's lives being affected, being reshaped, could tell us what might happen somewhere else. And so I traveled a lot to Texas, to Oklahoma, to places that it seemed might be leaders in terms of abortion restrictions, and tried to use those really like human anchored narratives that you just don't always get the time for, especially someone on the probably more relatively junior side in a lot of newsrooms, to invest in a way that I would if I were not at the 19th, which is part of why I think nonprofit
Explain the
news.
name.
Oh, sorry?
Explain the name.
Oh, of course, yes. The name of the 19th comes from the 19th Amendment, the amendment to the Constitution that gave women the right to vote. And we tell that with an asterisk because something Emily talks about, our CEO and our founding editors, is that even when the 19th Amendment took effect, women's suffrage was not a complete project. People could not vote because of race. In particular, people could not vote for other reasons of discrimination, whether that's disability, whether in some cases class. And so we think about suffrage as an unfinished project, and we are trying to tell stories that think about gender as it affects everyone, and that asterisk is sort of a way to think through who are the people's stories that are not being told when we think about women and we think about gender, and how do we build a more inclusive and ultimately, I think, more truthful telling of that.
Helen, do you want to interject anything? George, just go straight down. Helen, talk about sort of the idea of, I mean, I've written a lot about vaccines, and many of us in the room have written a lot about vaccines in the last few years. And when I would look on YouTube, it did get better, and partly because of the work she's about to tell you, you would see credible accurate,
Yeah.
videos about why answering questions, but accurate, honest, and vaccines are good for you. So that was because. Well, why don't you just?
Yeah, no, I'm
talk
happy
about
to, and just, delighted to be here. Probably nobody wants to read my new book on quality measurement in healthcare, but if there's any nerds in the room, I'm happy to share it. This was actually, I think, really important work, and I have to give credit to Google. It was actually, they came to the National Academy of Medicine on YouTube and said, we recognize we are now in a situation where the most viral video gets read because it's what comes up to the top of the algorithm, and it may not be accurate at all. It may not be a credible source. And so they came to the National Academy of Medicine, ultimately my group as well as WHO, and say, could we come up with some criteria to identify who are the most credible sources? Now, a key caveat, and Joanne and Lymari and Josh talk about it in this book, is that we don't necessarily know that those who we considered credible write credible information, but we thought there was a pretty good shot at that. So at the time, the idea was, if you meet the criteria of being science-based, objective, transparent, and then we added one about thinking about equity and being of a community that you're trying to serve, pretty logically you would be credible. So government agencies, which we'll come back to, were the top of the list. Groups like mine, all the specialty societies, were at the top of the list. Credible organizations that had clear paths to be able to put forward information that we knew generally was correct. And what essentially Google and YouTube did when they had these criteria was they then created these little shelves, and you can still see them on YouTube actually, so that if you search for health information on YouTube, the first video that comes up meets our criteria and comes up in a little shelf and says, this is from a credible provider. Which is great because it broke the algorithm that said the most viral, even if the most wrong, was at the top. So credit to Google for actually wanting to do this work. We did it hoping other groups beyond YouTube would pick it up. It was really credible sources on social media to date. Look at TikTok. None of it has been picked up beyond the work that the folks at YouTube did. Now, what's interesting is we never were able to go back and in fact assess whether those sources we identified as credible are credible. We think they are based on the criteria that they had to meet. But the comment I think Joanne is referring to is we put the government at the very top of that list as being the sources. I would often tell my patients, oh yes, please go to the CDC website. You'll see everything you need to see about this vaccine. And they are still considered credible. And part of it is because it's now been adopted in more than 10 countries. And around the world, the government sources are still considered credible. So we have to really think about this. But I was very pleased to see when the New York Times listed out their top 5 most credible sources of health information a few months ago. American Academy of Pediatrics and the American College of OB/GYN were among those top 5 for a good reason, because they really are providing trustworthy information. And frankly, a lot of what we have had to do now in the medical community is kind of recreate the data sources that would have been credible had the government been doing them. And many of you are probably very familiar with what's happening in the vaccination space of groups like the Vaccine Integrity Project and many of our societies now putting forward the guidelines that are being used by health plans to determine payment for this year, 25 through 26, for immunizations. So it was a good idea. I still think it's a good idea, but I think at the end of the day, there's still a lot more work to do. I mean, even in the clinician space, we have to really be teaching nurses and doctors and pharmacists about how to counter this misinformation, but also ensuring that we're trustworthy sources as we're talking to patients and they still have a sense that what you get from your clinician is likely credible. But it is definitely not where we expect it to be when we wrote those papers for national medicine proceedings a few years ago.
Thank you. I think you're taking on an incredibly difficult challenge. One of the things that we write about is the asymmetry between very emotional, compelling content that is wrong
Yes.
or very misleading, and the somewhat dry, boring content that is more accurate. In one of the classes that Joanne and I taught, we gave an assignment. We divided the class into 2. One half, go find a TikTok that is responsible on the question of myocarditis and COVID vaccination, and the other half, you get to find one that's irresponsible with as many views as you can find. And the one half, the video is, something like, "Hi, I'm Josh, the TikToking pediatrician," and the graphs start showing up behind me. Did you know that there's more myocarditis from COVID than from the vaccine? It's like 4 minutes. While we're watching, the class is on their phones. They are not watching the video. Then we go to, and they have like 70,000 views or something. Then we go to the other one, and it's like shot like the Blair Witch Project, and it's like, I am in the closet of the intensive care unit. I'm one of the nurses. All of the beds are filled with people who've been, hearts have been destroyed by the COVID vaccine. We're not allowed to report it to the FDA. Millions of views.
Right.
But the more interesting thing is, I'm looking out at the class, they are riveted. The whole video, it was riveting. And so, it's not just that there's a lot
Correct.
more information.
Yeah.
It's that it's very different, and the way it's presented is very different. And even if you can get the thoughtful, expert information to the top of the algorithm,
Yes,
it's
it has to
still
be
hard.
compelling and watchable.
Yeah.
And so that's part of what we also did, is then worked with YouTube to help actually train some folks to put together some content. And there are some great people out there. My son, who's 21, loves Dr. Mike because he did the explainer of The Pit, like episode by episode. And now anything Dr. Mike says, as far as Sam's concerned, is like correct and fabulous. And I'm like, and I was like, he's a great guy. He's a really smart family doc. So I think some of this is we need to learn what they have done and apply it in a good way on good information in ways that we have not yet done before. And we all need to learn how to do this. I mean, I'm really hopeful that my medical students and residents who have come up in a generation as digital natives where they routinely watch, actually they don't even watch YouTube, they basically just watch TikTok, will they have a skill set to be able to impart this information in a way that's really both accurate, trustworthy, and engaging?
But back when I was in your patient doctor class, this really wasn't
No.
a topic, but it seems like it's kind of required these
Yeah.
days. Given the environment that patients are.
Oh, absolutely. And I'm also on the board of the Coalition for Trust in Health and Science. And what we've really been talking about, too, is there are skills here. There are known skills that are talked about in the book, like pre-bunking and debunking and using your personal narrative, that we have to train healthcare professionals how to do. Right? I don't think a lot of us have those skills to be able to counter it. Or also, it's also really well known that it's very easy to just say, you have to get a vaccine. And then the conversation ends. And instead, you want to leave that door open to have that continued dialogue. And that's exactly what those techniques are that are really nicely outlined in the book.
Thank you. And let me just say, this is the third book talk we've done. The other two were much more depressing. I would just say, this is actually, we're talking about solutions, even starting from the beginning with Eric and the different work that's going on here. So I'm going to slightly quit while we're ahead because we have such a great group here in the audience. We have a tremendous amount of knowledge in health reporting, and I'm just talking about Amy Goldstein, in addition to everybody else. So I think it'd be good to have a bit of a conversation. We have just such a fantastic panel up here. Please introduce yourself and just tell us how you think about this challenge of the information environment. How optimistic or pessimistic are you, or any questions you have for our great guests here? Yes. Well, let me come around so everyone can hear you online.
Thank you so much. I'm Carmen Pan. I'm a health reporter at Politico, one of Joanne's reporter from a few good years ago. Just in terms of how you respond, I find that many administration officials, starting with the health secretary, would easily say, just don't listen to these doctors. They are paid by pharma. Check the website to see how much money your doctor is making from this particular vaccine producer or drug producer. In some cases, it is the case that doctors, take money or other benefits from different pharmaceutical companies. But how do you, they all kind of present it in this very conspiratorial way where everyone is basically conspiring together, from big pharma to big food, to keep you sick and make money off you being sicker and sicker. So how do you respond to some of these elements that might be true, but then they get put together in a sort of narrative that at times is really hard to disentangle element by element? Thank you.
I'm happy to start. I think it's a great question. And I hope that a lot of this comes down to the relationship that I think people build with their clinicians. So Washington Post just very recently published an article showing that the single most trusted source in America for parents is their pediatrician on vaccines. Still, in spite of all of the sort of morass that we're hearing, the pediatrician is still the most trusted source. So I think as much as we can teach folks like us to be able to impart that information in a way that they're trustworthy. I think you can't just say I'm trusted because I'm a doc. Trust me, I'm a doctor. There used to be buttons that said that. And it's not you can't do that anymore. In fact, there are doctors who are not trustworthy. But I think that's part we have to impart is get clinicians to in fact earn that badge of being trustworthy, learn how to communicate in a way that patients and families understand, and also take advantage of bringing out folks of that community who can speak to that community in ways that we often do. That's why we added the equitable and inclusive criterion on purpose, because we think that's a really important way to make this information get transmitted.
Thank you. I'm going to say something slightly provocative, which is I do think that good public health and good journalism kind of have a common enemy here in just the miserable information environment and just the fact that there are people who are not interested in truth at all. And I do think that one of the ways, not that anyone's doing anything differently in their job, to think about this is supporting good journalism is something that the healthcare system could do, and supporting good public health is something that journalists could do. I was once called by a political reporter who wanted to write about someone who had left I used to work at FDA, who left FDA in a high position and went right to the pharmaceutical industry. He was asking me like 25 questions about the revolving door, perfectly fair story to write. And I said, you'll be calling me again about the senior officials from FDA who didn't do that for that story? And we had a good laugh about that. That story's never been written. But I do think that, like, you know, there are very credible people in all these worlds who have
Right.
nothing to do with this, but you know, that's an important part of the story to tell too.
Two things, if I can add just a couple more thoughts. I think the point about trust from clinicians is something that, as reporters, we also should be thinking about. And I mean, there's so much conversation now, I think, especially in largely online media spaces. When you work in a national setting, how do you build relationships with your readers, and how do you build trust so that they know I may not feel comfortable with this other news outlet or this other thing, but I know that I really think this reporter's work is really good, and I will trust them if they write something because I know they've done their homework, they've done fact checking, they provided all the context that I think is really important. And I mean, we talk about that a lot. I think part of that is finding ways to meet your readers where they are, whether that is, you know, creating space for readers in social media communities, whether that's NPR does great work on Discord. There's really smart things you can do on Reddit, on Instagram, on Facebook, if that's where your readers are, and try and find ways to have conversations with your readers and meet them at face value, take their questions seriously, answer them with like truth and honesty and context and nuance. And if you do that work, it's annoying because it's more work on top of very demanding jobs that reporters have. I think it really pays off in that when you write something and you explain, hey, this administration official said this, but it's maybe not fully accurate or kind of misleading for X, Y, and Z reason, they know that you're someone they can trust and they will take that information to their community.
Hi, Susan Hebe. I'm a reporter with Reuters, and I covered healthcare for 10 years when Joanne was there. Quick anecdote and then a question for you all. I thought about that Washington Post story about the pediatrician recently because we had a visit. And if doctors are the worst patients, probably journalists are the second worst patients. I was like, well, let's see how this is going to go, you know. And the approach that we received was, can we interest you in a vaccine today? And I kind of thought about like fries or a drive-through or something. I thought, well, that was okay, not quite what I was expecting in this environment. So in addition to trust, one thing I've been thinking about a lot lately in the misinformation space is supply and demand, right? And you have this sort of deterioration in the news industry, and it's not just about trust, but it's about demand and media literacy. So if anybody can go on their phone and just start looking and Googling and AIing everything they want to know, how do you help create that desire and that demand to go to trusted sources and the news media to help people navigate this information space?
Yeah, I was just going to say one way that I built trust when I was the health reporter that is not being done now is I covered like the county. We have a county health board, county and city health board. Every 55 counties in the state have a county health board. So you go to the meeting. It's usually made up of doctors and other people. You write stories, you make connections. I covered the hospital board meetings, and those county health boards are no longer covered. Um, we used to go to the nonprofit the meetings of nonprofit hospitals. They shushed me out and went into executive session a lot, but it was a good way to meet, local hospital administrators, doctors, that sort of thing. We also we don't we with the vaccine issue. I used to, when I was the education reporter, I covered the State Department of Education. Went to all their meetings. Those are no longer covered. Nobody covers them. There's various agencies, the Healthcare Authority, the West Virginia Board of Medicine, the West Virginia Board of Osteopathic Medicine. Those are no longer covered. I covered those. The West Virginia Board of Pharmacy. So I think making all those connections help connect with readers. But when I say all that, I think if I still would cover all those things, I don't know if that would make as much of a difference today as it did, 5, 10 years ago.
So it's sort of getting the demand by covering things that nobody else is covering. Other thoughts?
I think that I think that the poll, the Washington Post story, I think it was a KFF poll. I mean, most of us in this room probably do have a doctor we trust, right? Maybe we have not liked every minute of it, but most of us have a care provider. But there's two problems. A lot of Americans, was it one out of 6 couldn't name who their care provider? Something like 1 out of 10 kids does not have a pediatrician. There are various numbers about how many adults don't have a regular, but there are huge gaps. So if you don't have a physician or a nurse practitioner, whoever your primary care provider is, if you don't, whoever it is, if you don't have one, you can't trust them. And the other thing is, like, yes, there are these polls showing trust in doctors, trust in your doctor, trust in nurses, and yet the distrust of vaccines is still plummeting. So yes, doctors and nurses are really, really important, but they're not. It's way more complicated than that. And in debunking and pre-bunking and all these things that we're trying and testing, I mean, that's sort of the gloomy part of the book. Well, one of the several gloomy parts of the book is the techniques for combating disinformation are very embryonic. They don't work great, right? If they worked well, we wouldn't be in this mess. Because part of it is the collapse of media. I mean, if you don't have people like Eric in most towns in America, right? But if you relying on the doctors, because it's only going to get worse. I think the uninsurance rate is going to skyrocket in the next few years, right? Medicaid is going to be hit. Community services are going to be hit. We're not entering an era where that piece can reinforce and combat the distrust.
Yeah, I'll just mention one quick thing. Karen DeSalvo, the former chief health officer of Google, has this great slide that information is a determinant of health in ways that I think we often forget. But I think even if you don't have somebody you can go to, figuring out how you can at least create environments where they can go somewhere to get good information is critical, because if they don't have somebody to ask, there has to be some place to have that equalizer of being able to get information.
Yeah, I mean, your question is a pretty profound one, and it reminds me of a review we got on the book at one point where someone said, why are you paying so much attention to journalism? You can't pay people to read the newspaper. And there was like a study that somebody did where I think they tried to pay people and they wouldn't do it. So if people are used to getting news in a certain way, or information, I should say, in a certain way, how do you get people to reorient? I think the idea of telling them things that they really might be interested in that nobody else can tell them is an interesting answer to that. I'm curious, Helen, on the Google, did you have a sense of how much you moved the meter with Google from 90% bad to 85% bad, from 50% bad to 30% bad. You know what I mean?
Yeah.
Because, you know, you can do good projects with Facebook, and the number one post in the world with Facebook was an erroneous post about a doctor dying of COVID vaccine. You know, billions of shares, something.
Yeah, you know, we've asked, and we don't have a good evaluation other than the fact that YouTube says they've seen people really move, that they will, of course, click on what comes up first. So I think at least the idea that the most viral thing that could just be awful is no longer at the top,
Yeah.
I think is really positive. So one of the things that we talked a lot about, Megan Rainey, Dean of School of Public Health at Yale, was the chair of this committee. And one of the things we talked a lot about was the concept of a garden, that, you know, the constant pulling of the weeds of misinformation and disinformation is just not doable anymore in this current environment, but that we can cultivate a garden of good sources out there trying to put good information out into the ecosystem.
Yeah, I agree. I would also say that I don't think it's too much to ask for more transparency from
Agree.
social media companies on questions like what's worked. You know, where are we actually? And policy is a relevant consideration. We talk about it. Oh, go ahead. Who's that?
One of the things we talk about in the book is a lot of disinformation is really targeted at specific groups and communities. And one of the promising things in the book is also that there's new media and nonprofits that are really giving voices to communities that have not been heard before. But there is a lot of, you know, Spanish language disinformation that's targeted at certain people. We also write about Capital B, which is a terrific nonprofit that's covering Black America, and it's a mix of local and national news. But in the audience today is somebody, Rafael, is from Facchequiado, which is a global organization, but also working in the States, sort of combating both in a Spanish language, but also somewhat of a cultural difference as well as a, you know, it's a linguistic difference, but there's also, you're working globally in a number of different cultural differences. But do you want to talk, you know, briefly about the work you're doing in Spanish language? And Facchequiado, obviously, even those of you who don't speak Spanish could figure out what it means.
Thank you, John. Yeah, we were co-founded by the biggest fact-checking organization in Argentina called Chequeado, and the biggest one in Spain called Maldita. And one of the challenges that I've heard is one of the things that you mentioned about the consequences of losing people or journalists to being able to work on a specific topic is something that we really know a lot about. One of our issues is that we're about 70 million Latinos in the United States, and the whole country is full with news gaps. Latinos who aren't able to get information in their language, who aren't able to get, we only have two national news organizations, Univision and Telemundo, and they're not 24/7 the best quality information out there. And so we are in an environment where local Latino outlets are small, let's say sometimes only a couple of people or just one trying to run a newspaper. And in that sense, when we talk about social media, in general, social media, we all know when it comes to moderating content in English, it's not good at all. Now imagine it in Spanish. Whenever they fire content moderators, they fire most of them in Spanish. So at times the same piece of mis and disinformation that you were able to see in English, if you see the same one in Spanish, if it gets taken down or moderated or whatever, it will happen first in English, and in Spanish will stay there longer. So it's a huge challenge that we have ahead of us. But one of the ways that we found at least a way to work together was first, we do have a reporter that works completely specifically on health issues. We partnered with KFF, which has been great as well. But also, we were trying to see how can we get into the communities that need the most. And so we are not going to be the trusted messenger for the Latinos in Philadelphia or the Latinos in Kansas. But there are small Latino outlets and people trying to do their best there. And so what we did was we partnered with them. We work as a nonprofit. And the idea is they know what their communities are worried about. They know what their community needs. They know what their communities are seeing on TikTok or Facebook or YouTube Shorts or Reels or whatever, and they alert us. Every week we have a meeting with them, and they tell us, hey, in our communities, they're wondering if this homemade cure or medicine is real that just went viral. Is it true for, if an example, is it true if a woman, I don't know, pees on, I don't know, a bottle of water with this and turns in different color, doesn't mean she's pregnant, and that went viral. A bunch of things that okay, so how can we tackle this? So we help, we create the stories, we give it to them, and they can, use it however they want into their communities because people trust them. So I think it's a huge challenge, and one thing that will, just give you something to think about is how we can also support people who are doing the work in different languages, especially when social media just lets any sort of disinformation just run amok when it comes to, in my case, in Spanish-speaking communities. But yeah, a collaborative approach and knowing, who are the trusted messengers from, community outlets, from churches, your pastor, the priest, or whatever is approach that has been working so far good for us. Thank you.
Thank you so much. That was great. And, I think were this more of a public health crowd compared to a journalism crowd, we'd be talking about some of those very same strategies in terms of how to create in real life messages. Okay, we'll do two more, and then we'll be done. We're ready for snacks. Go ahead.
Hi, I'm Mary Agnes Carey. I'm managing editor of KFF Health News, so thank you for all the kind words. I appreciate it. Oh, that's very sweet of you. I'm going to leave now, but I wanted to kick a question, start it with Jane, and others can jump in. Jane, I know States Newsroom has a lot of outlets in conservative states reaching people in those areas with information that is accurate and fair about issues that may have a different political stance. Or get misinformation. What's your newsroom strategy? And then if others could jump in, how do you get to the gettable folks who want to hear more information, perhaps from other sources?
I don't know that we have a strategy really aimed at red states. We are in a lot of red states. We're in a lot of rural states. And our approach is to be as transparent as possible about what we are and our funding and our reporting and our ethics and everything else. And we all talk to each other a lot. 39 states, and we're all on the same Slack. And people pose questions and look for help and look for assistance. We have national editors who work with our states, who can provide help and perspective and sourcing that they may not see on their own. But, in the end, it may be that we have more people who are, not of the conservative end of things who are reading us. I really don't know. But you also, I do think, if you try, that if we try to go, to talk to as many Trump voters as we can, to try to talk to as many people on all sides of the equation as we can, we do better. So no, there's not really a specific strategy. And in some cases, we're kind of, even just speaking out for the value of journalism is not popular. In some of these places, but we try our best.
Hi, I'm Susan Milligan. I'm not a health writer. I'm a contributing editor for the New Republic. I used to write for the Boston Globe and the New York Daily News. If you'll indulge me 1 second, I was also a judge in the Dirksen Award, and I just want to say, so I can embarrass you now instead of telling you privately, how impressed we all were with what you did, particularly given the fact that you don't have this enormous budget, and how it cheered me up to know that somebody was still making the effort to write about how policy affects real people, which is what the submission was, as opposed to, oh, this is what we found out Chuck Schumer said about Johnson behind closed doors. Who cares, right? And I'm so pleased someone's still doing that. It actually, it cheered me up. I mean, the stories were upsetting, but it cheered me up to know that you're still doing that, so thank you. So I've mostly covered politics, and I think that there's a parallel here with the misinformation and where it comes from and why people want to believe it. And I thought about it this morning because there was this stuff going on in New Jersey where there were these bomb threats against certain polling places that had closed for a while. So immediately people are posting online, oh, these are Republican districts, or Republicans vote on the same day, so these are Democrats trying to suppress the vote. And of course, it came out about an hour and a half later that these all came from foreign accounts. So it made me think about two things. One, why are people, because they got so many hits, these people who said it was, a political plan. Why are people drawn to this misinformation? Is it kind of some manifestation of an establishment sentiment, like you're sticking it to the man by not believing, what the principal tells you or the CDC tells you? And two, is it possible that there are also foreign entities, because I do think that people have a vested interest in having a dysfunctional and divided America, are there foreign entities who are also feeding the health misinformation?
Yes.
Yeah, the answer to the second question is definitely yes, and there's been some good reporting on that. Yeah, particularly on vaccines, actually. Other?
There was a very good report on vaccines and disinformation from the Stanford Internet Observatory a couple years ago, and a lot of the vaccine misinformation is coming, or was at that point, this is 2 or 3 years ago, China, Iran, and Russia. So yes, I mean, when people say it's a foreign conspiracy, it is in fact a foreign conspiracy.
And there's some very interesting research, some of which we talk about in the book, about why these sorts of theories are so appealing, why people jump to them, why they want to throw a punch. It can, and what it means. There are different things. I'll just share one of them here, and it has to do comes from Sarah Gorman's book, which is called The Anatomy of Deception, and her book argues that the frustration people have with the healthcare system, with getting healthcare, with not getting a ridiculous bill in the mail, with not feeling totally powerless, which frankly I don't know anyone, no matter what their degree of sophistication, doesn't feel when they go in the healthcare system. But some people, I mean, the bills pile up, they're driven into bankruptcy, that makes them so ready to be angry. And in the book, she tells the story of someone who lived in, I think, upper Midwest somewhere, like Minnesota, who was a complete, COVID denier, refused to get vaccinated, moved to Norway in the middle of the pandemic, got free healthcare, got vaccinated, came back to the United States and went right back into it. Had a bad experience with the healthcare system and went right back into it. It was like a challenge-re-challenge study, for a biological intervention. And so, it's not just, individual psychological things. It can actually be the broader policy environment that contributes to the ability of some of these things to spread. Give a last notes. Any final comments anyone wants to make, and then we'll break. If anyone wants to buy a book, they're outside, and we'll sign them here. Absolutely destroying their value in the resale market in the process, and then go ahead and have snacks. And it's a great group of people here to talk. Any final comments from anyone?
I won't talk long. I think that, when you read the book or whether you've done work, look at other things of misinformation, the reason it really plays on our not our bright sides, right? It plays on our fears, it plays on our anxieties, it plays on our resentments, it plays on our vulnerability, it plays on our, when we play these silly games in classrooms. I mean, I think we need to start teaching digital literacy, like in preschool. But if you think about it, it preys on all these, it takes advantage of those negative emotions. And you think about how we feel. This really got out of control during COVID, right? I mean, it was bad before, and it's going to keep getting bad. But when did this really become, really? We went from being something we were worried about to an existential crisis. How were we feeling during COVID? We were afraid. We were anxious. We were isolated. people were worried about, many people were really hurting economically and wanted someone to blame. So it was really sort of this perfect storm for the bad guys to win. But they're really good at it, and it's really quite frightening to me to sort of see how good they are at it. And it's not just vaccines; it's like sunscreen and fertility and vaping, everything.
Great. Now this is starting to sound like our other book talk, so we have to pull this out. Yeah. Thank you.
It's a great book.
Yeah.
Buy it.
Helen, any final words there?
I just want to emphasize the point you made earlier, which is that this is a tough time. And I think the idea that this book really emphasizes how we're all in it together. So you said journalism, public health. I would add in healthcare as well.
Sure.
I think that we have to work together to counter this. Only one of us alone won't be able to do it.
Great. Well, on that note, thank you all very much for coming.